Stand up. It's recording now. Everybody stand up. Make sure the camera can see your face. Okay. Here I am.
Oh, there's Paula.
Here comes one more. So we got 11 then.
Come on.
We got 11 then. Okay, everybody can sit back down.
Even though you win it, you can miss it.
Yeah, I'll just stay behind the camera.
Yeah.
Except his heart rate's going to drop. Now he's out of his own.
Right here.
Sorry, my granddaughter called me.
Is this close enough? Okay, I think I got it. It's good.
Good evening, my name is Jason Romine. I'm going to be giving you a speech on how to start an IV in a patient. IVs are used for patients if you need to draw blood, give medicine, or give IV fluids to help with dehydration in patients. For the purpose of this speech, I'm going to be using this as my fake arm. First thing you need to do when you're starting an IV is gather your supplies. One supplies is a normal saline flush, your IV needle, an extension, and then your IV start kit. When you open anything from an IV, you want to make sure you keep it as sterile as possible so that it don't get infected. Inside you'll have an alcohol prep, some tape, a tourniquet, and a tegaderm. First thing you want to do is take your tourniquet and wrap it around the patient's arm, preferably up here. This here is called the antecubital fossa, and this is where most IVs will go in an emergency situation. And preferably over on the right side, that way it's closest to the heart. So once you get this tied on, you tie it on and get it pretty tight, and that will make the veins pop up and easier to find. It'll make them easier for you to fill. Next, what you'll do is you'll take your alcohol prep, you bust it, and you're going to clean the space, which is right in here, in a circular motion, starting from the inside, working your way out. I've drawn a black line on here to improvise as the vein. For cleaning, you want to scrub for 15 seconds and actually let dry for 30 seconds. What most people don't know is that the drying part is actually what kills everything. It's not the scrubbing part. While that's drying, you can be opening everything else that you have to use. So once you found your vein and you clean it, you don't want to touch it no more so you don't contaminate it. And for the sake of the speech, I'm going to improvise putting on, if this was real time, you would have on safety gloves to protect yourself from the blood and anything that might be on the patient. Once you pull a needle apart, it's got a needle inside, and on the outside of the needle is what's called a catheter. It's a plastic device that will actually stay inside the patient, and that's where the blood comes through. And then you want to make sure that there's a bevel on the needle, and the bevel is down whenever you place it inside of the patient's arm or the vein. Once you find your vein, you take the needle at 30-45 degree angle, and you're going to place it in the patient's skin. And as soon as you get in the skin into the vein, you're going to see blood in that white catheter right there on the needle. You then want to take one of your fingers and advance your catheter. After doing this, you're going to put pressure above the site, which is going to stop the blood whenever you take your needle out of your catheter. For these here type needles called insights, if you push this white button, it pops the needle out, and the needle's right here. There's no needle in the patient no more, it's just that little white plastic catheter. After that happens, you're going to take your extension set, keep it as sterile as possible, and put it on the end of your catheter and screw it on. At this time, no more blood will leak out unless you try to pull it out. Holding it in place, you're going to take your tegaderm and put over the site. That's going to hold it down temporarily. and make sure it doesn't go anywhere until you can get it taped down. At this time, you're going to take your tape, tear about 2 to 3 inches off, and then tear it in half. You're going to put one strip underneath the IV, looping it over the wings of the catheter. Then you take your second strip, putting it straight over the hub of the catheter. Then you're going to take another piece and you're going to secure the rest of your tubing. You want to get it as secure as possible so that in a transfer process or anytime the patient moves, nothing is going to pull this out. At this time, to make sure, you'll hook your saline up to the end of your hub, and if you were to pull back and it was in the patient's vein, you would see blood come out into this tube. At that time, you can flush, you can push it back in, and that would flush it back into the arm, and at that time you can take the tourniquet off. Prior to leaving the patient, you want to start flushing and lock this at the same time. It's called a positive pressure flush, and that will decrease the chances of your IV clotting, having blood clot in your tube, and it will keep it good so you can use it more than one time. After that's done, it's good for 3 days before it has to be changed out. That concludes my speech. Thank you for coming.